This is Pamoja Weza Women's Center, which started as a women's social support project for women with HIV and poverty, and it's become a health clinic. And we've recently built a laboratory in the back, and we provide primary care here for the local community for people who can't afford health care in the regular health system. We're a licensed clinic, and we have a pharmacy, and we have trained nurses, doctors, and social workers who work here.
Today we're running a blood pressure clinic, and people are coming from the community. We've advertised to let them know that today we're going to be measuring blood pressure. So people have already come to line up and have their blood pressure taken. Most of them will have brought their books, which will be in their pockets, and we'll record the blood pressure down. If the blood pressure is high, we'll refer them on to their medical officer and the local nurse, who can help to adjust their therapy and get their blood pressure under better control.
So this is Sister Victoria. She's our senior nurse who's working here. She just joined our team in the last month, and she's here right now. This is kind of the work area where we triage patients. So they come in and they get weighed and they have their blood pressure taken, and might identify what the issues are, and then they go in and see the doctor. These ladies here are helping prepare for a mobile clinic that we're doing tomorrow to a Maasai village. So they count pills out, and in fact what they're counting right now are what's called stat doses of deworming medication. So everyone in the village will be dewormed, and they take all 5 pills at once, and it should clear any worms that they have in their intestinal tract. And we have these all packed ahead of time to speed up delivery. You can see them there. So high blood pressure is actually the most common disease in the world. It's easily managed, and I like to say, it's not rocket science, but it's not done well in many poor health systems. So our project grant is in something called implementation science, which isn't just like a clinical trial where you take a bunch of people who have high blood pressure, put them on medication, and see if the blood pressure is lower at the end of the study, because we can do that. But that doesn't fit within the healthcare system here. So our project has multiple different layers that work from the community level up to the level of the policymakers or the Ministry of Health, so that we can show them innovative ways and inexpensive and efficient ways and effective ways to manage high blood pressure within their community health system. So high blood pressure medication is actually not that expensive, and with the newer combinations of generic medicines that are coming out of India and some that are even being made locally on the continent, most people can treat their high blood pressure for less than, well, in Tanzania, 100 shillings a day, which is 10 cents. And it's a new issue that's being recognized as a major burden of illness, and we are going to work at different layers in the system in a research method to show that what we've done is effective and adaptable and scalable. So scaled up to be more than just our 1 or 2 clinics that we're working out of in this area, so that it could be expanded to 10 clinics or 11 clinics, which take up all of Machame, or regionally or across the country.